It's the podcast that shakes and stirs up pharmacy. Welcome to PBM on the Rocks.
Welcome everybody here to PBM on the Rocks. I'll be our host for tonight's festivities. Joined here tonight by our Executive Director, Monique Whitney. How are you, Monique?
I am so very well. Andrew, how are you?
I'm doing well. Thanks for asking. Also with us tonight, our esteemed PUT board member all the way from Lubbock, Texas, Chris Hobart. Howdy, partner. How are we doing?
Good. How's everybody?
Good. I guess before we introduce our two guests for the evening, I think we need to address the elephant in the room here. Where the hell is Lord Dr. Jeremy? No need to check any jail rosters or area hospitals. Everybody's favorite Hokie is doing just fine. He's off spreading the good word at a conference in Baltimore, so he's doing okay. But with that in mind, it's my pleasure to introduce our two guests for the evening's cocktail hour. First, a man that does not need any introductions around here, John Farina of AIDS Healthcare Foundation. How are we doing, John?
I am delightful.
Delightful is good. We like that. And then our second guest for this evening, it's my pleasure to introduce Matt Ansay of Streu's Pharmacy in Green Bay. It's his first time on the program. How are we doing, Matt? How's the frozen tundra?
Not too bad. A little frozen tonight. It's quite chilly, but go pack, go as always. And
Nice.
drinking a little bourbon to help me through a cold.
I like that. What kind of bourbon we got rolling there?
Just some Bullet. Nothing's
All right.
fancy.
Nothing
Well,
like that.
drinking Bullet down here in the great state of Arizona, where it's freezing at something like 63 degrees.
Oh, you poor thing.
Ugh.
And I'm drinking a limited edition Woodford Reserve sherry cask finish bourbon, which is
Ooh, that's sharp.
Uh,
For this episode, I went and took a special trip to Wisconsin and got some spotted cow. What do you think about that,
Nice.
Matt? Yeah,
Very nice. Very nice. A fine beer.
I thought you'd like that. Well, John, how have you been? What's going on with AHF?
I've been great. We are, humming along, fighting the good fight for the world of 340B and against the PBMs, continuing our educational work, and our clinics are doing great stuff. We're making things happen. We're doing a lot of work in the States with some contract pharmacy stuff, and yeah, we're just kind of going and going.
Can't stop, won't stop.
No, exactly.
I like it. All right. Well, Matt, why don't you tell us a little bit about your pharmacy and what you got going on in Wisconsin?
Yeah. So Streu's Pharmacy is an independent pharmacy that's been in business for 70 years, serving the people of Green Bay, Wisconsin, in the greater Green Bay area. We have a community pharmacy, and we have a long-term care pharmacy as well. Serve about 3,000 patients within about a mile radius. But unfortunately for us, PBMs are making it incredibly hard for our community pharmacy to stay in business. And we're actually going to be closing our community pharmacy next Friday, unfortunately. So Green Bay is losing a great partner, a healthcare partner, and it's pretty sad. But excited that we're going to be able to continue to serve the people of Green Bay with our long-term care pharmacy.
Man, very sorry to hear that.
Yeah, I went through the same thing, Matt. I worked at a pharmacy in Lubbock that had been open since 1956. And it used to be next to a Piggly Wiggly was the store next to it. It's called Twin Oaks. We had some pictures up in there from the 50s when it was the first one with like a soda fountain in the area. So they had all the soda fountain pictures, and I had all those on the wall. And they had some meds in the back that I got cleaned up and made a display for in the pharmacy. And I just loved all the old pharmacy stuff. I still do. I still collect some. I got some on a shelf right above me from back in the day. And man, it closed about 3 years ago. It broke my heart. And just to see it close after being in the community. We had people that had grown up with it. Their kids and either parents, grandparents, kids all went to the same pharmacy for years. And I mean, it's just brutal to see that happen. I hate to see that happen to you too, man. It's everywhere, unfortunately, with the PBM.
Yeah, It's really sad. But when we grind peanut butter at Streu's Pharmacy and sell it, and when we're making more money on peanut butter than we are on scripts, it's a pretty sad way to live.
That's wild.
Really? So that was one of the fun sort of side services that you did. How did you get into doing that? I haven't heard that before.
I'm not entirely sure how we got into it, but man, is it delicious. We have people that would come in and they actually ship the peanut butter around the United States. People just love it. And then when people come back for the holidays, they'll come in and ask for pounds and pounds of peanut butter. So
Nice.
Wow.
Usually just sold toothpaste. Got to get into a different game.
yeah.
Well, yeah, because like so we have there's another pharmacist, Nikki. She's in Georgia. She runs a bakery to keep her pharmacy afloat. So we've been learning all the ways that pharmacies have to get creative to stay in business. And when that happens, I always remember one of my very first meetings in the state of New York, meeting with the chief of staff for the assembly speaker. And that guy's saying, well, why don't you guys just sell more toothpaste to make up for the lost prescriptions? Everyone's heard this story. If you tune in to PBM on the Rocks ever, there's a good chance you've heard me now tell the story like 100 times. But it just goes to say, you can't say it enough. There isn't anything you can sell enough of at any store, community pharmacy, or otherwise it's going to make up for the loss of the under reimbursed prescriptions. So, I mean, peanut butter, that's crazy. What a cool idea. And dang, sorry
Yeah.
to be there.
It's kind of adjacent. Right now we have a PBM reform bill up in Wisconsin, and the Speaker of the House is basically preventing it from coming to vote, even though it would likely pass because
Robin Voss.
he will not be named. He basically
we'll name him. Hey, Robin, figure it out.
He basically says if he owns a popcorn business and he can negotiate with Amazon, there's no reason we can't negotiate with the PBMs. So why would he vote for our bill?
We've got about 200 emails that we could send him from PBMs that say, we do not negotiate. We do not redline contracts. This is not negotiable. I'd be happy to send those. What did you say his name's Robin? Robin, you want that?
Robin Voss.
Email for you.
We send him a personal we're closing letter just to let him know.
Did you?
Yep.
Oh, that's good.
Wow.
At
this point, if you don't know that you can't negotiate with a PBM, if you are in the position of being a lawmaker and you don't know that, you are either the dumbest person on the planet or you are willfully remaining ignorant. Because
and it's if you're not going to go against PBMs, which is sort of kind of a popular thing amongst Republicans, Democrats, like everybody wants to go, 340B is one thing, but everybody wants to go against the PBMs. They're kind of the evil empire. And if you're not willing to do that, then who's paying you? Like, where's that? Why are you not willing to even move a bill about it? Which everybody's against them. So this is not like you're picking on something that people like.
Especially a bill that has so much support, especially in Wisconsin. Yeah. It's unfathomable.
The bill is named Cole's Law because someone died because of PBMs.
Yeah.
How evil can you be not to give that a vote? I mean, just that's wild that they wouldn't even give it a vote. But that's how the PBMs work. They find that, part of the bottleneck that they can squeeze. And, I think we saw the same thing happen in Louisiana when they had their bill almost go to a vote. And we were all watching on the live stream for the Senate. And then the live stream didn't come back after they took a lunch. I guess the PBM executives flew down there or whatever happened. And it just never happened. We just watched people fiddle around in the Senate House for 4 hours. Like, hey, you guys going to do your jobs? And nope, I guess you can pay them not to. So that's what happened there. And we're watching it happen again in Wisconsin.
Pretty sad.
Chris, have you ever been around when the PBM lobby shows up at a hearing? Have you had that experience yet?
I have not. No, I haven't been able to testify yet.
It is straight out of a movie. I have. And they'll do this even at the piddliest little committee meeting where we had this happen a few years ago when we were trying to run a patient steering bill in Arizona, which we still don't have a patient steering law in Arizona. And we were just in the health committee hearing where it was pretty much a foregone conclusion it was going to pass. And just right on cue, like the doors opened and this army of suits all marched in. and the whole vibe of the room just changed. And they were all there for that one bill. They will buy up anything with a pulse and walk it into the room in a business suit just to, throw off the vibe and make it clear like they are here and they're not here to play. They're gonna rough you up.
Beady black eyes.
I met with a senator from Texas, and that's what he told me. Like, as soon as we try and put the ink to any of these bills, as soon as our pen touches the paper, their jets start revving, they're landing in Lubbock and telling us, like, hey, y'all can't do this. And they're just all over it. And yeah, that's ridiculous.
Yeah.
They
still get away with it.
Yeah.
Money,
The money talks, I guess.
Definitely. They look like the Mafia and the prescription benefits Mafia. And I think there's a docu-series that you can't name or watch. Yeah.
That might be out of Wisconsin too.
Yeah, Matt, that we can't even put a documentary on Amazon about PBM. So we can't negotiate with Amazon.
That's a good angle. I like that.
Tell your story of that, Matt. We can't even put the documentary up on Amazon without getting sued by Optum. So, sure, his popcorn stand can negotiate, but we can't even put a show out about it. That's wow.
That's a good idea.
Sounds like we should pitch Scorsese to do a movie called Badfellas, and we could, we can have the PBM guys like stuffing pharmacists in the trunk to the music of Layla, like they do in good, it's possible.
There you go.
Yeah. Yep. I like where this is headed. Yep. Yeah. We get some horse heads in beds too.
Sure.
Like, perfect. Nice. Yeah. What do you think the future is for Streu's? Is it going to be the long-term care business is going to be okay, or?
Yeah. We luckily the previous owners had some foresight to really build that LTC patient base, and so we've got a really nice, thriving LTC business. That's what we're really good at. We love to do it, so I'm excited to lean into it. We're still going to get some community touches with those LTC at home patients,
nice.
And we've been kind of leading the way on billing clinical services as well. In Wisconsin, we have provider status, so we're still able to maintain our medical billing, even though we don't bill prescriptions through our community pharmacy. So that's exciting. And then we are going to have a small little cash pharmacy for some of our more loyal accounts, compounding, employees, that type of thing. So the community pharmacy isn't going away. It's just going away to the public.
Just can't operate the way it used to, which is a shame.
Yeah.
Man, I actually used to live up that way. I was in Appleton for a while, and Streu's was a mainstay up there. And it's when I heard that news, one of my buddies said, I couldn't believe it. So heart goes out to you guys, and hopefully you'll be okay, and just keep fighting the good fight up there, man.
Yeah, we're definitely still going to be involved. We're still going to push on some of those. We frequently host legislators, so we're going to keep pushing on them. My business partner is the president of the Pharmacy Society of Wisconsin, so we're pushing and fighting for everyone. We want to come back.
Good. We want to see you come back. And you do some work with the state organization too, right?
Yeah, I do.
Long-term care stuff. Is Wisconsin? I actually did one of my rotations at PSW, which was nice. So I know a lot of those folks, and they were fantastic to work with. I think I would say they helped start me on my advocacy path, which is kind of a neat, and it's coming a little bit full circle here, which is cool. And I feel like do you think that they support independent pharmacy pretty well?
Yeah, I think that they do a good job of supporting independent pharmacy. They advocate for us. PBM reform was their top priority, but they do represent pharmacists who work for PBMs, who work for chains, who work for hospitals. So they've got to fight for everybody, which I understand. But I think they do have a special spot for independent pharmacies.
Yeah, that's good. I know there's a lot of states that aren't in that boat, where their state organizations really do not fight for independent pharmacies. So I think you're lucky to be there. That's for sure.
They're a fantastic group to work with.
Yeah,
that's great. That's very fortunate. But you still have Senator Mary, right? She's we had the pleasure of meeting her several years ago, and she is a formidable champion for pharmacies. What did she say, or is she aware that your pharmacy closed?
I'm honestly not 100% sure. I don't know that we sent anything to her specifically. That's a good idea. We should send something to her and let her know.
Yeah.
But with my business partner being the president of the Pharmacy Society of Wisconsin, she gets to interact with all those legislators on a regular basis.
Yeah, I
Does
think
she know
it's
you're here? Do we need to keep a secret?
She knows I'm here.
That's good. Hi, Nicole.
Hi, this is our PBM on the rocks. Yeah, I think it's a good idea, to what you did in terms of sending that letter to the speaker of the House, right? Yeah.
Yep.
Okay. Yeah, I think what you did was the smart thing by sending them a letter. I mean, that brilliant idea, just brilliant, to make sure they know, like, we told you, we said it was going to happen, and it happened. It's on you now, sir. Good sir.
Yeah, I think that's just the most frustrating part is you bring them in, you tell them how close everything is to failing and why it's such a fucked up system, and they just don't believe it. They don't believe it. They can't get it.
Yeah, it's almost like it's almost like they don't believe it. It is insane.
So we actually have just going to plug something Put's doing here. We have a new initiative called the Stack, and what we're doing, this is from John Hoshin in Minnesota. He dropped the Stack at y'all's meeting up there, Andrew, and I'm gonna do it here. What you do is you print out all the prescriptions that you're paid less than your cost to dispense. So for Texas, that's $10.12 from like a 2014 study. And I just printed out mine. It is half my prescriptions for this year. Yeah. And my printer got so depressed it turned off. It stopped printing. We're going to let it sleep it off and then try and print the rest of the stack tomorrow because it's so big. It's so many lost prescriptions. And you can do it and, take the HIPAA out. But that's something that I can bring to a legislator's office.
If you haven't seen the stack video, it was a very powerful prop. In fact, one of the senators on the committee said it was probably the most effective prop he's ever seen. But we do need to correct the record on where the stack came from. Actually, PUT President Deb Kivney was the one that came up with the idea of the stack. But
our own
John bolted it and wielded it very effectively in our committee hearings, extremely effectively. Mm-hmm. And it's gotten a life of its own.
Not this John.
Not that John. Yeah, no, it would have been a good. You could have come up with that, but no. John Hession at St. Paul Corner Drug has taken that idea, and his is big. I mean, I printed out mine, and I'm like, I'm a small pharmacy, right? So mine was still 70% of my business, but it was small. And John made fun of me for how small my stack was, but you got to take it what you get. But it was when he went up to the dais to testify, and he went boom, dropped it right on there, and everybody kind of was like, oh, what is that? And it really made a big effect. So we're gonna start encouraging everybody to make their own stack, and I think it's going to be an effective tool going forward. You're right, Chris.
I think the point is that we wouldn't have had any of these negative stacks if Congress would have acted and passed PFB last year. It had enough. We got all the co-sponsors. Didn't get called for a vote, of course, as seems to be the case as we're talking about. But yeah, if Congress would have acted, we wouldn't have had this giant stack. So pass pharmacists, fight back. Do it 2025.
That's what Chris. Elon called and he said he was really sorry that he tanked that bill.
He did apologize.
Yeah, felt bad about that.
He didn't call to apologize.
What's a PBM?
Yeah. So, but I feel certain that Elon will not be a problem this year, and we will be well on our way with not just one but two Pharmacists Fight Back Act bills to be filed. As this is airing, it will be mere days away from being filed. So it's going to be good stuff.
It's coming.
Yeah. And for anyone who wonders, what are we talking about? You will want to go to pharmacistfightback.org and see our landing page, which explains these two bills, which are the first introduced in Congress for PBM reform that actually do something for the pharmacies and their patients, because pharmacies and patients are connected at the hip. One needs the other and vice versa at all times. And so this bill actually does something. Yes, ending spread pricing in Medicaid has been a big, big deal. And so this bill actually does something. It will be well on its way with not just one but two Pharmacists Fight Back Act bills to be filed. As this is airing, it will be mere days away from being filed. important. That's good. I am a taxpayer. I do not want my tax dollars going into any, PBM shareholders' pocket. But Pharmacists Fight Back Act is really about ending these practices that are designed to undercut the pharmacy network and keep business squarely, inside the health insurer / PBM system. So encourage everybody to go to pharmacistfightback.org. Check out everything. You're going to see the 5 reasons to support this bill, and you can, if you want, and we hope you will, send a message to your legislator letting them know why they need to support this bill and vote yes when the time comes.
That's right. So, John, what is going on in the 340B world? I know that's not something we get to see a ton of, but we rely on your expertise over there.
Yeah, there's some stuff going on in states. A lot of contract pharmacy bills, mainly, we're seeing kind of move. The big pharma is running lots of ads. They're tying 340B to illegal immigrants and surgery for trans kids. So they're basically saying that's where 340B money goes, and that if you vote for 340B, you're going against President Trump's agenda. So they're trying to rally Republicans, but it's backfiring on them, and yet they keep doing it. It backfired on them in Oregon, in Oklahoma. It's backfired in a couple of other states. They're pushing right now in Ohio. There's a contract pharmacy bill going, so they're trying to fight that here. But again, they're kind of pissing legislators off because they're like, "Hey, this is not what we're doing, and we're trying to work with you guys," but they don't want to hear it. They just want it to go away, and so they're throwing every bit of mud that they can. And then in Congress, it's just kind of on hold. Nothing's really happening. There's this gang of 6. They kind of dick around a lot. People keep talking about transparency, and it sounds nice, so that it's a soundbite. But there's so much reporting that goes on from an organization. The Ryan White Clinic has to report so much for their Ryan White grants, for their other federal grants, and then they have to report all the stuff they're doing around 340B. So there's so many layers, and 340B organizations pass their audits, huge, in the high 90s. There's not a big problem. Yes, there's a few abusers, and they're big hospitals. That's a big hospital problem. That's not a 340B problem. That's a Cleveland Clinic, Bon Secours problem. Billions of dollars, multi-billion dollar nonprofits that, don't do community care and that push it off on other organizations. So that's the problem with them. That's not the problem with us. It's not the problem with most community health clinics. It's not the problem with any community health clinics, with any Ryan White clinics, with any, small hospitals, dish hospitals, rural hospitals. So, but they keep talking about transparency. So that's kind of floating around. Ohio slipped something into their budget about transparencies. It's not onerous, but it's just another layer of nonsense that we don't need to be dealing with. We'll probably not see anything 340B federally until next year.
No, okay. It's just a shame because it stinks so much, man, because it affects the people that are trying to do the right thing. And that seems to be a similar story for independent pharmacy as well. Like we're just trying to do the right thing, trying to care for people, and there's so many things that just get in the way of that and they don't let us do it. It's wild.
And that's why we as an organization, are committed to the idea of independent pharmacy because, we're a nonprofit pharmacy and we're pretty big. So granted, we're a large organization, but community organizations, community pharmacies, like this is kind of the base level. People with HIV, for example, use pharmacies like the ones you folks own because those are community pharmacies. Their pharmacist knows them. They don't have a Ryan White clinic in their community, so they know their pharmacist. They don't want stuff delivered in the mail because they don't want their parents or their roommate or their boyfriend or girlfriend or whatever to see what's coming, or their mailman to know, because there's still stigma attached to HIV, and so people are still afraid of it. Even though people don't talk about it. So, the idea that community pharmacies mean a lot to our clients as much as our pharmacies mean to clients or people who live with HIV in different communities, rural communities, where they don't have Ryan White clinics. They rely on either their community health centers or their community pharmacies for their medications. And if if you guys go out of business, CVS ain't going to
people got to go, right?
California to open up a clinic. They're not going to an India, a Native American reservation, in Eastern Washington State to open up a CVS pharmacy. It's just bad to see these things go. This is what serves the community pharmacies, nonprofit pharmacies, and we're the ones that are doing the work on the ground, not CVS.
Right.
And John, it seems like particularly HIV, AIDS, these particular chronic illnesses, I feel like they've been really politicized in a way that we hadn't seen for a long time. And I was wondering, why would big pharma choose to jump in on the politicization of that now? I mean, I'm trying to figure out like what the benefit would be for them, maybe other than money, because I think we're starting to see some outbreaks of HIV. We haven't seen this in a long time right now because of different policies that have come into place around
yeah, I mean, we're seeing stuff like that. I mean, now you may see more later as these budget cuts and things that have happened earlier in this year and early, those things will start hitting the ground, later. So it's kind of like a lag, which the folks that are doing this, they count on that lag. They count on we're going to hurt this now, but you're not going to feel it till we're gone. And so, pharma, of course, they're the big player in there is Gilead, and they love their HIV drugs. They're riding on HIV drugs. They're not making the big money on their other cancer things. They're trying to diversify, but their portfolio is HIV drugs. So we're constantly fighting with them and with other big companies to say, you guys can't pick on us. We're just people trying to serve the community. People living with HIV can't handle increases in their cost. ADAP, Gilead wanted to raise prices to AIDS drug programs around the country. They came out with a program. They said, we're going to raise the prices to ADAPs all over the country. And the community just, went ballistic. We fought them. We protested. We hammered away. We got a sign-on letter with over 100 organizations to tell them, no, you can't do this. They backed down. It's hard to say to pinpoint exactly what made them back down, but I have a feeling that every state ADAP director, was basically railing them, saying, we can't do this. You're going to kill people. Maybe somebody had a conscience somewhere along.
And I'm hearing a distinct crisis emerging in the future based on what you just said about the relying on the lag. Pharmacies are closing. My pharmacy, which is an amazing pharmacy here in Phoenix, is down in the Melrose district, which is a thriving, it's actually won awards. It's struggling to stay open. Just like there's a pharmacy down in Tucson whose whole community, she's in a master plan community of seniors. So because of the way Medicare is, she is struggling, and that's a community that is reliant. And, based on what you're talking about, we could start seeing, chronic illnesses emerge in a way that we haven't seen in a long time. And there won't be pharmacies there to care for them in the way that people have gotten used to it, like the Ryan White clinics. So that's wow, interesting.
And it's not just pharmaceuticals; there's all kinds of things. We've got into the culture now where corporations are focused on one thing: shareholder value. They want to make money for their shareholders. They don't care about their employees. They don't care about their customers. They don't care about their clients. They don't care about anything. They worry about shareholders, and the more money people make, the more money they make. Look, the stock market's at some ridiculous, level, 9 billion, 1,000 points or whatever. It's crazy. While the rest of the economy kind of struggles, the stock market is in this huge place because there's such a divide between what we're doing on the ground and what corporations are doing, and then on top of that, they don't pay taxes. So we're it's just going to keep getting worse if we keep this kind of system up because it's not sustainable. It can't stay that way. And so it's throwing out the door the idea of community pharmacies or nonprofits or Ryan White or anything that's not making them a problem. PBMs could easily revert back to being just the little warehouse middle person that just moves the box from one place to the other and not these big profit-making ventures.
They're just spreadsheet jackies. That's it.
Yeah. I mean,
that's all we need to do.
That's what they were supposed to be, right? They were just supposed to be like a little thing that just, something had to it had to go somewhere and then and hold it until it needed to go to the next place. Now it's like, I don't know, some kind of, oh, we can make money on this. Let's raise the village until we make more money.
They open the box before they ship it.
Yeah, and they take what they can out of it. Oh, and they figure out how can we get the 340B money or this other, like they milk it as much as they can, and then tell you, oh yeah, by the way, you owe us money, more money.
Oh yeah, like 4 to 6 months later, we're taking that back. Sorry.
Oh, you're trying to move this drug? You're trying to sell this? No, excluded. Off the list.
Yeah, that's so true.
The whole idea of like even the way just the whole idea of prior authorizations. My doctor prescribed a medication to me, and it's expensive, and it's fortunately I don't need it per se, but it's like one of those things that certainly is helpful and useful. But nope, we don't do that. And the other version of it, it's not on plans. It's like, okay, like who? Why some AI is now making?
I was gonna say. Oh, sorry to cut you off, but I mean the ridiculous part is it's an AI doing it. It's not a real person reviewing that. It's all AI now, and the rates of denial are going way up.
Yeah. I mean, even Marriott uses AI to determine whether or not you get an upgrade.
Yeah,
like AI is taking over the world. My husband's a librarian. He just hates AI. He's like,
is he a Dewey Decimal guy?
I'm sorry.
Is he a Dewey Decimal guy? Like loves it.
He's a children's librarian.
I had to, couldn't resist. I'm sorry.
But he's like every time he signs on to Microsoft, there's Copilot, and there's like AI will help you, and like I don't want to deal with you. Shut up.
Yeah.
And I keep trying to tell him like you can use it as a tool and blah blah blah. But anyway, yeah, AI is like making decisions. AI should not be making decisions on medications or prior authorizations for surgeries or medical procedures. That's not something AI should be doing. It's not able to do that. Maybe someday it will be, but I just don't think these are things that should be done without human intervention.
I agree 100%. And I think we learn in school, like every prescription that comes through your door isn't just a piece of paper. It isn't just something that comes over electronically. There's a person behind that prescription, a life, somebody that needs that prescription. And now we're reduced to a computer algorithm deciding if they can get that prescription or not. Kick rocks. Get out of here. Like, yeah, that's somebody's life. That's somebody's mom. That's somebody's grandma. That's somebody's aunt. Like, what are we doing?
Mm-hmm. It is wild that you go to your doctor, you get diagnosed, you get a prescription, and then what the PBMs want is for you to electronically send that to their mail order pharmacy where an AI robot's going to tell you don't need that and send more paperwork to your doctor just to deny it and have no human interaction, just a machine telling you not covered, prior authorization, $600 copay, all just coming from some machine. Mm-hmm. That's what they envision healthcare as.
And good news, profits will go up 23% this quarter over last quarter because arbitrarily somebody decided profits had to be like double digit, 23% higher, so yay, that'll happen. And screw you, person whose mother needs this, medication, right?
Oh, and by the way, your premiums are going up next year. That'll be fun.
Yeah.
Yikes.
I'm telling everybody who will listen, I'm on the hands down shittiest bronze plan on the ACA. My premium is going up 87% from $482 to $901 a month. My copays on this same plan, my copays are doubling. Some of them are going to become co-insurance. They're going to become percentage based. The deductible is still extremely high, and I lose access to my pharmacy, and I lose access to one of the two doctors I have. And they're just and so I'm in there.
I have to pour more now.
Yeah, they are right. Good news, everybody. I'm in Maricopa County. I am in a huge freaking county, and of all the plans that are available to me, and there's something like 75 plans between gold to bronze. Not a one of them will let me have doctors, my pharmacy, the handful of very, very common generic maintenance medications that I take, and be able to have it on a low price. And I'm a low utilizer. So for me, I look at that and I'm like, that's how I've got it. I can't even imagine what it would be like to have like school age kids. My kids are grown up, they're adults, right? I couldn't even imagine having to put a family on a plan like that. That's gotta hurt so bad.
We're talking like family, like premium family for family plans. They're going to like $30,000 a year. That's crazy.
For not
That's
even
not
good
su-
coverage.
Yeah, and for no cover. Yeah, for no cover. That's not sustainable.
Just to have an AI tell you they're not going to pay for it.
But yeah, here's a gift card and a gym membership. I don't know. Absolutely brutal. Matt, you got anything to say on that? What do you think?
Yeah, I think the whole system is just completely messed up, and I wish we could just go back to straight cash. Everything would be cheaper. Yeah, cut the middleman out. Just go to cash. I mean, everyone wants to use their insurance on their prescriptions, but I can sell it to you for way cheaper. Just cash. Just pay cash.
Yep.
So all right. So I have a question, because this is somebody, people have asked me this question and I don't necessarily have a great answer. So you all being pharmacists at pharmacies may have an answer. GoodRx and these other kind of like things, are they good, bad? Do they hurt you? Like, what's the story with this?
Was that an intentional finger, Andrew, or?
Oh no, that was an innate response.
I thought the middle finger.
It just does that.
Yeah, if you say GoodRx, I start pushing you out the door.
Yeah, I need another drink now.
You should dive right now. Now it's time for us to pour. Yeah, Chris, tell John what makes them bad, because I actually think this is one of those things that is confusing to consumers, because I have a hard time explaining it, and I've been doing this for a decade, and even I'm like, well, it's like this, but then it's like this.
So the first question you ask, you're watching a GoodRx commercial during the Super Bowl, and you're like, how did they pay for this ad? Well, the answer is, when you pay $15 for your pharmacy for that medicine, about a third of that, probably $5, depending on the cost, it's $5, $10, $15. I've been clawed back like $140 when I've ran one before. They claw that money back. So when you pay $15, maybe 10 of that or 5 of that goes to your pharmacist. The other 10 goes back to GoodRx. So that's how those work. They set the price and then they claw money back as their fee for running their coupon card. That's why independent pharmacies don't take them. Only a few like CVS's and things like that, if they have some kind of membership. But where they've gotten really evil is they merged with the devil itself, the PBMs, and they're embedded into networks now. So they use something called lesser of logic. And let's say if your copay was going to be, $30 and the insurance was going to pay us $50 or something like that, but then it's $26 with GoodRx, the insurance is going to not be the insurance, not pay you the money. They're going to go with the lower cost that GoodRx just made up, and they're going to claw back. The PBM is like, your insurance company is going to charge you a $26 copay, and then 10 or 15 of that is going to go back to the insurance company through the GoodRx. So that's how they've embedded themselves into our healthcare. They say, look, we saved you $4 on the prescription and we didn't pay any money. We get to keep that, and we get money back that you spend. So you paid us for health insurance, and then you paid us for the prescription coverage, and then you paid your copay to Chris's pharmacy, and you paid half of that back to us. So they're literally making money on everything. You've paid for the plan, you've paid for the prescription, and all that is going back to them, while they have paid nothing to cover you, nothing to help the healthcare provider that helped you. So, I mean, just an absolute drain in the system.
Algorithmic price fixing. And then, John, I will ask you a follow-up question here. What does GoodRx say about, do they need your information when you sign up?
I don't know. I've never used it, and I don't think we take it. For example, I don't think we take it at our pharmacies. Yeah. The questions come up from other people outside, because they know. Well, John, you work with pharmaceutical. Every time they see me post something, I'm at a pharmacy conference. They're like, oh, well, tell me about this. And and I've heard people say, oh, well, I use GoodRx, and I'm like, well, yeah, you shouldn't use that. And then I didn't have a good answer to say why you shouldn't use it, because they're like, I'm paying $10 for my whatever drug, and I guess I don't care about the person who's losing money on the other end. I'm like, well, that person's not going to be there someday, or they do it at CVS, and so they don't really give a shit about CVS. But I feel like there's a lot of misinformation on the idea of what GoodRx is, and there's other ones. It's not just GoodRx. There's a whole I guess now there's a whole flurry of these.
Yeah, I would say especially for AHF, for y'all's patients, they are going to take that data, whatever drug you got. You're going to get targeted ads. They're going to sell that data. So if they know,
That's one of the reasons why we don't take those kinds of things, is because we're very controlling. So we want to control everything. We don't want you to have anything. So that's why we're all internal. We have everything's internal.
Data is very important. Your data is very important. That is what I was kind of getting at, is it's deceptive advertising, because they say we do not need your patient information when you sign up for GoodRx, but you give that GoodRx card to the pharmacy. When the pharmacy runs that claim to GoodRx, they give them your patient information.
Yeah, they're going to share it with your health plan. So let's say you went off insurance, they're going to share that with your PBM. They're going to share that with advertisers, with Facebook, anybody that'll buy it, and there's plenty of buyers out there. So don't give them your data.
For packaging and selling that data. Yeah.
Correct. Yes. They had to pay a fine for doing exactly that.
They found their niche. I mean, kudos to them for finding a niche for it, but not good. Don't do it.
Evil RX.
I feel like there needs to be some kind of campaign that exposes this kind of thing. Just like, it's taken years for people to start to understand that PBMs are bad, right? So, I mean, how long? I mean, Monique, we've gone back a while, and before I got involved with anything, like, this has been going on a while, and people just are finally starting, when you say PBMs and you explain it, like, oh shit, that's bad. Yeah, that's bad. Now GoodRx is like, I feel like there needs to be like a campaign that explains that this isn't helping you or your pharmacist or anybody except somebody making money on the other end.
Yeah. And it goes back to the same thing that is true no matter where you are in whatever industry you're in. If the item is free, you are the product being sold. And so that's what people need to understand. And the hardest thing sometimes to overcome is the person, especially right now when things are so expensive, the person is like, hey man, I just need to afford this medication for my kid. Like I don't have any more bandwidth to deal with this. Okay, that might be fine now. But again, you got to consider these long-term ramifications, because down the line, this is going to be a problem. I promise you. The thing we saw when Change Healthcare went down, that's the beginning. That is the beginning. And we are only at the beginning of what we don't know that we don't know about our own data, and what happens when hacks happen and when it gets in the wrong hands. It's hard to get it across to people, but I'm optimistic that we can, because I think, it took forever to get people, as you say, to even, keep listening after you said the words pharmacy benefit manager. Now people are getting to know that a little bit better.
Right.
They're starting to understand, but it's still like, we got a bit of a mountain to climb still, but we'll get there. We will get there.
Well, and it's interesting that you bring up the Change Healthcare thing. Like, so the Change Healthcare, that's what's called a switch. So it's the intermediary between the pharmacy and the PBM or the insurance company, and it has to go through this. It's basically a clearinghouse. And United bought Change, and they I read they have access to 1 out of every 2 patients in the country's data. 1 in every 2.
That's crazy.
That's insane. And then it got hacked twice. What? And then they don't tell anybody about it.
Yeah.
And the company that owns it's being investigated by the DOJ for fraud.
Uh-huh.
And, yeah.
Yep.
Which also Minnesota is doing something interesting. Aren't you guys?
Oh yeah, you hired Optum to investigate fraud in the Medicaid program. Good call.
Yeah. Wow. What a just dumb move, Minnesota. So the goat's now the gardener, or whatever you say. That is a dumb move.
You draft J.J. McCarthy and you have hire Optum. There we go. Minnesota.
Cigna came out with that rebate-free program. And, put out a statement, because Cigna said, we're going to do away with rebates. We're going to do, full pass-through, whatever nonsense they're coming up with, but we're not going to do rebates anymore, which is wild, because they sued Trump's administration during the first term and beat him in court. PCMA did, to stop him from ending the rebates. So he tried to end the rebates his first term. He, they took him to court, PCMA did, and they beat him. And they still kept their, the kickback exemption? Sorry. The anti-kickback statute rebate exemption that PBMs have. Trump tried to get that removed. That would have been a huge game changer. but unfortunately, PCMA won that, and now Cigna's going rebate free. So we just want to say that we support ending the rebate exemption.
Yeah, thanks for kicking that off, Express Scripts.
Yeah,
I agree.
crazy.
Rebates,
You
get them
sued
out.
the president, and now you're doing it yourself. Okay.
Yes. We
That reminds me-
actually we posted that on our X, and it made me wonder how many people actually get our sense of humor, because I think it confused people more than anything.
It's a
We
little
support United's.
Yep.
It was United. Right? We support their
That's
decision to give up rebates, or however it was we put it. It was very, very clever.
Yeah, I heard they want to end the kickback exemption. Sounds good.
So,
I don't want to toast to that to end the night, but it does seem like we're coming to the end of our drinks here. What should we toast to?
I think we should toast to you for doing a great job in your first time as leading the rocks of the panel. Great job, Andrew.
Appreciate that. Thank you.
And
Everything,
Matt, look, you're still alive. I hope you'll come back and join us again for another podcast sooner than later.
I have a
absolutely.
great time. Thank you very much.
And we
Yeah,
should
thanks,
toast to
man.
John, because at the time that this airs, we will have done the most amazing live podcast for World AIDS Day. We want to keep attention on that at all times. So yay, and thanks to the AIDS Healthcare Foundation for the great work you do. Really, really great work, and for being inspiring all these many years. And
We are happy to be partners. We are happy to be partners with PUT.
Yay.
And when somebody asks, what's the difference between PUT and NCPA? I said PUT is the AHF, whereas NCPA is everybody else. So PUT is rowdy like we are. So
Yes. And in fact, this would be a good time. So for everybody that's listening, mark your calendars for May 1st, Friday, May 1st. We are going to have the biggest protest ever at CVS headquarters in Woonsocket, Rhode Island. We are inviting everybody. It is not for nothing that we put this on May 1st. It's the May Day protest. That's the state of our healthcare, and we are declaring May Day. And so we're inviting everybody to be there. And of course, the incredible AIDS Healthcare Foundation. What is the word that the word is escaping me, but they were so amazing. They led us all in the chants, the leaders, but when we were protesting, or protest leaders. They will be there with us, and it will be. This is something everybody needs to be at. If you care at all about healthcare in this country, you're going to want to be there for May 1st. So more will be coming on that.
Into the breach once again, my friends. Cheers.
Cheers.
PBMs are robbing you day in and day out, making you work for below-cost reimbursements. Billion-dollar corporations hurting hard-working independent pharmacy owners as they line their pockets and put so many of you out of business. And now it's happening with so many pharmacy software vendors that have sold out to billion-dollar hedge funds. Are you truly happy with your pharmacy software vendor? Is support what it used to be, or you find yourself waiting on hold? Are your issues resolved in a timely fashion? When is the last time you took a look at the bill from your pharmacy software vendor? Perhaps it's time for a change. Visit our website at www.datascanpharmacy.com and give us a call at 1-877-222-7979.